In this tutorial, we're going to be looking at ways that you can minimize your risk of disc herniation and disc bulge. Going to break it up into a few parts. First of all, we're going to talk about injury mechanisms. Then we're going to quickly go over and sort of summarize why people think they've got a bad back and how a bad back really comes about, because there's a slight difference in why people think they've got a bad back than what's actually going on. So we'll quickly overview that and cover that, but in some ways it will come out in the first bit in the injury mechanisms, but I just want to sort of highlight that and summarize it a little bit more. And then we're going to look at some ways in which we can reduce your risk. So in some respects, again, that will kind of come out in the injury mechanisms, but I want to make a bit more of a formal point about it and highlight it and sort of give it its own little section so we can really focus in on it a little bit more. This information is coming from Ultimate Back Fitness and Performance by Dr. McGill. It's a very useful book. I've had it for a long time, been using it for a long time, been following his work for a long time. So I use that one, and also you might be able to see just over my shoulder there, I've got low back disorder. So when I'm working with people with a bad back, not only in a more sort of fitness and sporting setting, but also in a sort of a rehabilitation setting, these are my sort of, in some respects, go-to books, and then I will use other sources of information to help reinforce it. But generally, this is probably the most well-researched information on bad backs, so I tend to stick to these two and then find any other information that I need elsewhere. So part number one, we're going to look at some injury mechanisms. So first of all, we want to look at sort of flexion bending. Now, that could be exercises like sit-ups, it could be sitting, or it could be stretching. So what we've got is essentially the spine going into full flexion. So we might be doing that in a stretch, as we sit, or doing a sit-up. Now that is, in some respects, that's the mechanism for a disc herniation or a disc bulge. So in some respects, how we go about reducing it is we don't do it. That's the easiest way, or at least we minimize the amount that we do it. So we've got sit-up exercises. We could go as far as saying lateral bending exercises as well. Obviously, we're going to talk about prolonged sitting in a second, which is ever so slightly different. And we'll talk about stretching as well. With regards to that, we've got the sort of second one, which is then the bending cycles. So it's how many times we do it. Now, our backs have a certain number of bending cycles, and this can be highlighted with a credit card. Now, this is half a credit card, but what we would do is when we were breaking a credit card, because it's gone out of date, which is exactly what this one's done, is we could either use a pair of scissors or we could bend it back and forth. Now, as we do it initially, we don't really notice much of a difference in the card, but then it gets weaker, it gets easier to bend back and forth. Now, this is what's happening when we do these sit-ups, do these crunches, and we go into any sort of flexion bending. So we have these bends in the spine, and then eventually it gets so weak because the tissues have become fatigued, it's very easy just to snap in half. Now, I couldn't do that before I did all that bending. So when we talk about flexion bending, and when we talk about having thousands of them or a certain number of them, this is what we mean. You won't notice it happening. So when you go and do a set of sit-ups, you'll think, I'm working my abdominal muscles and it's having no effect on my spine whatsoever. But what's happening is this bending back and forth is slowly weakening the tissues of the spine, and then eventually, at some point in the future, when your bending cycles run out, that's when you will get a bad back. So that's something to be thinking about, that it's not happening in the moment. It's like micro injuries that are happening in the moment, and then eventually the straw breaks the camel's back, and the spine, in some respects, or the disc herniates or bulges. When it comes to prolonged sitting, it's a slightly different mechanism because we're not bending back and forth. What's happening is we're just staying in that flexion position. Now, if you can imagine, that's a disc, so it's a bird's eye view of a disc. You've got a small ring or a small circular, or it doesn't have to be circular, it's not exactly circular, but you've got a small circle in the middle, and then the main disc is a lot bigger on the outside. And in the middle of that inside circle is a jelly-like fluid, and then the outer circle is just an accumulation of rings. So they go and then just sort of start off small and then get bigger and bigger and bigger and bigger and bigger as they go out. So it's basically a fibrous wall. Now, a herniation is when that fluid migrates its way through those fibrous walls and then pushes against the outer wall as a bulge, or breaks through that outer wall as a full herniation. Now, when we're sitting, when we're bending back and forth, like in the sit-ups and the crunches, it's doing it sort of pushing, like that. But when we sit, it's just constantly being pushed. So we need to be in a proper posture of the spine, and that's something to focus on when doing exercise. So avoiding exercises like sit-ups, like crunches, like lateral side bends. When you're sitting, trying to be in a better posture, so keeping that natural curve of the lumbar spine. And then when we go into stretches, we don't necessarily need to stretch the lumbar spine, because the tight muscles of the lumbar spine are generally a symptom rather than a cause of the problem. Generally, it comes about with the hips. So we would focus on stretching the hips, maintaining proper posture through the spine. So when it comes to the flexion bending, we don't really need to do it. There may be times where you have to do it because you can't bend down and pick whatever you want up off the floor without doing it. That's fine. We're going to talk about that a little bit later. But we want to try and minimize how much we do that. The next one is the difference between younger and older spines. Younger spines, they are generally more susceptible to herniations because they're more hydrated. Older spines are probably more susceptible to delamination because they're slightly more dehydrated. And that leads us on to the next one, which is twisting exercises or twisting of the spine. So again, if we're sort of repeated twistings, now this could be an exercise like a Roman twist or like an exercise machine, or it could be as simple as, reaching across a desk or whatever it might be. The same principle holds with regards to the amount of times that you do it. So if we do a lot of it, it's going to start causing a disc herniation. Now, the herniation comes about in a slightly different way. It's because it delaminates the disc. And what that essentially means is a bulge is where the fluid gets pushed against it and it breaks through it. When we delaminate and we're twisting the spine, the rings that I talked about earlier, they become separated, and then they become, because they're slightly more dehydrated, they become weaker, and what the fluid can then do is it can just start to naturally migrate its way through and then eventually can cause a herniation. So younger spines are generally more hydrated, and they will be more susceptible to the flexion bending and the sitting and cause a herniation. Older spines will generally be delamination that will then go forward and cause a disc herniation and a disc bulge. And then finally we come on to the disc shape. So we've got slightly circular discs and slightly more rectangle looking discs. Now it's not an exact circle and it's not an exact rectangle. They're slightly misshapen, but essentially there's a rounder one and a less round one, if you want to put it in that way. And with regards to the rounder ones, they are generally found in sort of smaller, slighter, skinnier, thinner people, however you want to put it. Ectomorphs could be another way of describing it. And the more rectangle ones are found in sort of larger people, thicker spines, more meso to ectomorph type people. The rounder spines, they are generally more susceptible to disc herniations. That's the wrong way round. The rectangle ones are generally more susceptible to disc herniations, but when the rounder spines get it, they generally tend to be more problematic. So there are different influences on the mechanism. Now, I'm not expecting people to know exactly what type of spine they have and how susceptible they are or how many bending cycles they do have. What we have to understand is using the spine correctly, which is what we're going to talk about in a second. Before we get into that, I want to talk about, just very quickly, just sort of summarise what's really happening with a bad back. Because most people think that there's something wrong with their back, that they've got this like default in their spine, and it was their body's fault. Now, as we look at disc or injury mechanisms, we can start to see it's the improper use of the spine, because we are flexion bending, we're twisting too much, we are putting too much stress on the spine because of prolonged sitting. So disc herniations are generally a manifestation of improper use of the spine. So that's quality of movement, so it being in the correct posture, and then the amount of time that it's out of that posture. So there's a quality issue and a quantity issue. So we use the spine incorrectly, so we use poor movement or poor technique or poor exercise form or whatever you want to call it, and we do it a lot. That is generally, if you look at the actual mechanisms, that's where the cause of back problems is coming from. Is that improper use of the spine from a quality perspective and a quantity perspective. So finally, how do we go about minimizing risk of disc herniations? Well, number one, as I've mentioned, if the cause is improper movement, we need to learn proper movement. So what that encapsulates is, number one, we need to maintain the neutral posture of the lumbar spine. The lumbar part of the spine is in some ways quite unique because it doesn't have, or the structures that are supporting it are the muscles. It doesn't really have any bony structures like the thoracic spine has. So the thoracic spine has the rib cage, which helps hold it in position and gives it a degree of stability. The lumbar spine doesn't have that. So the musculature has to do it. So we have to position the spine properly so we can maintain good disc health, good vertebra health, good facet joint health, so on and so forth. So number one is maintaining the neutral posture of the spine as we move, as we sit, or at least do it as much as we can, because I do understand that it's not going to be able to be done 24 hours a day, 7 days a week. Number two is no spine motion as we lift. So if we go into or lifting a box up off the floor or lifting a weight up off the floor, whatever it might be, we tend to find most people's backs will be, or pain will be triggered by a disc bulge or disc herniation during some sort of lifting action. Now that could be picking a pen up from the floor, it could be lifting a 100 kilo weight from the floor. It depends on the person's spine, it depends how far along they are in their sort of poor movement and bending cycles, whatever it may be. But what we have to understand is there are sort of three levels to it. The best level to it is maintaining that neutral posture, bracing the abdominals, moving from the hips, and lifting the weight using the glutes with the braced abdominals and the neutral spine. So that's the best scenario. Scenario number two is going down. The spine could then start to round ever so slightly, or at least flatten. You brace the abdominals around it, and then you lift. So there is no motion when you go from that sort of bent over position into the standing position. So that's the second best. The third, and let's just say the worst out of the three, is going down, bending the spine, lifting from the back, and not bracing the torso. So we've got a rounded spine, our tummy muscles are relaxed, and we're lifting a weight off the floor without any real due care and attention, because that would come under improper use of the spine. It's poor quality, and if we did that a lot, it's going to accelerate the problem that we have. The third one I've kind of mentioned already, but it's move from the hips and the shoulders. The hips and the shoulders are a ball and socket joint. This is just, you could literally read this in an anatomy book. The hips and shoulders are a ball and socket joint. They are known as a freely movable joint. The spine is what's called a cartilaginous joint, which is a slightly movable joint. So even in that description, we can start to see that it's more advantageous to move from the hips and the shoulders than it is to move from the spine. So when we lift, we maintain that proper posture as I've mentioned. We go down, we brace the abdominals, we lift the weight. We can do the same as we sit, but we don't have to brace the abdominals. We can brace it a little bit if we're conscious of that, but the main thing is being in that proper position. Then when we get up from the seat, we're not flinging ourselves from the seat. We might mildly brace the abdominals and then lift from the hips to get up out of the seat. And then the final thing is to keep your healthy spine bank account topped up. Now what that basically means is by doing all the things that I've talked about and moving properly, every single time that you do it, when you build good sort of core strength and core stability around your spine, you're adding another little credit, another pound or dollar into your account, and then that will start to accumulate. Every time you move poorly and bend from your spine, don't brace your abdominals, move from your back. You take one of those pounds or dollars or whatever currency it might be, you take one away. So the more we can move properly, and we can do that a lot, the more times we're adding to that account. The less times we do it, the more we take away. One of the things I was able to ask Stuart McGill is essentially on that topic. The more that we build a healthy, strong spine in the neutral position, every time we come out of it, we have a greater margin of error. So every time we hold proper position, what we're doing is adding another layer of stability, adding another layer of strength. Every time we don't, we take one of those away. So we want to try and keep it as topped up as possible. So to quickly summarize what we've talked about, to minimize the risk of disc herniation, number 1 is to maintain the neutral posture. Number 2 is about no motion in the spine. Number 3 is a little bit more about moving from the hips and the shoulders. And then number 4 is trying to keep that bank account topped up. And if we wanted to add another one in, it would be bracing the abdominals appropriately to protect the spine, because they're essentially the muscles that will hold the lumbar spine in position. So many thanks for watching. My name is Chris from Chris of Hulk Training. I will speak to you in the next tutorial.